1. Which principle of adult learning emphasizes the importance of connecting new knowledge to learners' previous experiences? A. Reinforcement theory. B. Experiential learning. C. Cognitive dissonance. D. Behavioral conditioning. When designing a curriculum for addiction counseling, what is the first step in the instructional design process? A. Developing learning activities. B. Conducting a needs assessment. C. Writing assessment tools. D. Selecting instructional strategies. 3. In evaluating the effectiveness of an addiction counseling training program, which method provides the most reliable evidence of skill acquisition? A. Participant satisfaction surveys. B. Self-reflection journals. C. Performance-based assessments. D. Attendance records. 4. Which communication approach is most effective when addressing resistance in addiction counseling sessions? A. Closed-ended questioning. B. Motivational interviewing. C. Directive instruction. D. Punitive confrontation. 5. A supervisor mentoring a new addiction counselor should primarily focus on A. Sharing personal success stories. B. Encouraging independent learning without guidance. C. Modeling ethical decision-making. D. Reviewing agency policies only. 6. When developing measurable learning objectives for addiction counseling training, objectives should be A. Broad and general. B. Observable and specific. C. Ambiguous to allow flexibility. D. Open to learner interpretation. 7. The principle of formative evaluation in counselor training is best described as A. Conducted only at the end of the course. B. Used for grading purposes exclusively. C. Continuous feedback to improve learning. D. Focused on administrative accountability. 8. Which adult learning theory emphasizes self-directed learning and intrinsic motivation? A. Pedagogy. B. Andragogy. C. Behaviorism. D. Constructivism. 9. When evaluating a counselor's adherence to ethical standards, which method is most effective? A. Peer review. B. Self-assessment only. C. Client testimonials. D. Written knowledge exams. 10. A counselor who encourages clients to set their own recovery goals is applying which adult learning principle? A. Learner autonomy. B. Instructor control. C. Passive reception. D. Cognitive overload. 11. What is the primary purpose of using role play in addiction counselor training? A. To memorize counseling theories. E. To provide experiential practice. C. To reduce the number of lectures. D. To increase test scores. 12. Which evaluation method best assesses the long-term effectiveness of addiction counselor education? A. End-of-course test scores. B. Client outcomes after treatment. C. Training attendance records. D. Immediate reaction surveys. 13. Which communication strategy helps maintain therapeutic alliance when clients express ambivalence about recovery? A. Active listening. B. Giving directives. C. Ignoring hesitation. D. Withholding empathy. 14. Which principle ensures training content is relevant to adult learners in addiction counseling? A. Emphasis on abstract theories. B. Focus on real-world application. C. Avoidance of learner experiences. D. Uniform memorization techniques. 15. When conducting a summative evaluation of a counselor's training, the main purpose is to A. Provide ongoing feedback. B. Certify competency achievement. C. Explore potential learning gaps. D. Encourage risk-free experimentation. 16. In mentoring relationships within addiction counseling, the mentor should primarily A. Impose personal counseling styles. B. Support professional growth and self-reflection. C. Provide detailed instructions only. D. Focus on administrative procedures. 17. The process of aligning learning outcomes, instructional activities, and assessment methods is known as A. Backward design. B. Program evaluation. C. Performance appraisal. D. Strategic communication. 18. Which adult learning principle is applied when counselors are encouraged to reflect on real client cases during training? A. Repetition. B. Relevance. C. Compliance. D. Randomization. 19. What type of evaluation emphasizes the improvement of training programs through ongoing feedback loops? A. Summative. B. Diagnostic. C. Formative. D. Norm-referenced. 20. Which communication technique is critical for reducing stigma in addiction counseling? A. Using person-first language. B. Applying medical jargon. C. Employing confrontation. D. Limiting dialogue. 21. Which curriculum design model is most effective for structuring competency-based addiction counselor training? A. Spiral curriculum. B. Tyler's model. C. Linear memorization. D. Informal learning. 22. What is the primary regulatory requirement for addiction counselors under federal confidentiality laws? A. Mandatory client disclosure. B. Protection of treatment records. C. Public access to counseling notes. D. Unrestricted data sharing. 23. Which adult learning principle underlies the use of case studies in addiction counselor education? A. Abstract learning. B. Experiential application. C. Passive observation. D. Random exploration. 24. In developing a training assessment, which method ensures the evaluation measures higher-order thinking skills? A. Multiple choice questions only. B. Essays and case analyses. C. Attendance logs. D. True-false quizzes. 25. Which mentoring technique is most effective for helping new counselors manage countertransference? A. Ignoring personal feelings. B. Encouraging supervision and reflection. C. Suppressing emotions. D. Relying on peer anecdotes. 26. A core principle of adult education states that adults learn best when A. Content is unrelated to their roles. B. They are passive recipients. C. The learning is problem-centered. D. Memorization is emphasized. 27. Which evaluation method best measures whether counselors can apply new skills in practice? A. Written tests. B. Observed role play. C. Attendance certificates. D. Open discussions. 28. Which form of communication is most appropriate in cross-cultural addiction counseling contexts? A. Cultural humility and openness. B. Rigid adherence to one approach. C. Avoidance of cultural issues. D. Uniform counseling strategies. 29. What is the role of regulatory compliance in addiction counseling practice? A. Encouraging personal discretion only. B. Ensuring ethical and legal standards are met. C. Reducing counselor workload. D. Limiting professional development. 30. Which curriculum development element ensures learning builds progressively on prior knowledge? A. Random sequencing. B. Scaffolded instruction. C. Isolated skill drills. D. Memorization alone. 31. When mentoring new counselors, effective feedback should be A. Vague and general. B. Immediate and constructive. C. Delayed and critical. D. Strictly punitive. 32. Which communication barrier is most likely to undermine the counselor-client relationship? A. Stereotyping clients. E. Reflective listening. C. Empathic responding. D. Open-ended questioning. 33. Which type of assessment is most useful for identifying training needs before developing addiction counselor education programs? A. Summative evaluation. B. Needs assessment. C. Norm reference test. D. Peer review. 34. Which of the following is the most effective method to engage adult learners in addiction counselor training? A. Lecture-based delivery. B. Self-directed learning. C. Memorization of theory. D. Standardized testing. 35. In the context of addiction counseling, what does the term counter-transference refer to? A. The counselor's projection of their feelings onto the client. B. The client's resistance to therapy. C. The mutual bond between counselor and client. D. The client's emotional response to the counselor's behavior. 36. Which of the following is considered a key component of ethical practice for addiction counselors? A. Acknowledging personal biases and adjusting accordingly. B. Encouraging clients to adopt the counselor's personal values. C. Withholding information from clients for their own benefit. D. Focusing solely on the client's treatment without external support.